Okay, welcome to our mental health podcast, where we're going to talk about ways to reach out and help those around us who might have challenges with their mental health. My name's Saffron and I work in mental health communications, and we're working with South West London NHS and South West London and St George's Mental Health Trust to tell you more about how you can help people around you. It's been a really tough few years with the COVID pandemic, the cost of living crisis and other challenges which have had their impact on many of us, and for some, our mental health. So we're going to hear more about what you can do to help your family, your friends, your neighbours and those in your community if you think they might be reaching a mental health crisis. And I'm going to talk to a trained mental health professional and somebody else with lived experience of mental health. So first of all, I'd like to welcome Kurt Hunt. Kurt, can you tell us, please, a bit about yourself?
Hi, my name is Kurt Hunt, and I'm presently the Clinical Service Lead for Adult Wandsworth Community Service Line in South West London and St George's Trust. My background is very much, I have more than 30 years as a registered mental health nurse with NMC, and I'm also a trained qualified psychotherapist. So I'm hoping that some of my experience and knowledge will give some insights into this agenda today.
Thanks, Kurt. And I'm also joined by Danny. And Danny, can you tell us about yourself, please?
Yeah, so I'm Danny. I've got lived experience of mental health challenges and difficulties, where I received a lot of help and therapy and support from the Mental Health Trust. I'm now actually working for the Mental Health Trust, delivering training to professionals around personality difficulties. I also do a lot of work for the involvement team, and I'm also a LEAP panel member for the MHIP programme, which is Ethnic Mental Health Improvement Project. And hopefully I'll be able to bring some of my lived experience to this podcast.
Thank you, Danny. Welcome, and welcome, Kurt. Really glad that you can join us to talk about how we can help people in our communities in South West London. Maybe, first of all, I think it might be really helpful to know a bit more about what the signs are that someone might be facing a mental health crisis. I don't know whether, Danny, you're able to talk about that a little bit. What should we look for?
Yeah, I mean, it was good that you mentioned in the beginning about over the last couple of years, it has been really, really very hard for everybody with the COVID and isolations and other things just going on around the world as well. So some of the signs I think I would identify with if I felt somebody was going into crisis, somebody probably being a bit too anxious, acting maybe out of their character that's not of the norm. Somebody who may be sleeping too much or not sleeping as much. Such as maybe suffering with insomnia that could be triggered from something, neglecting maybe their personal hygiene, and maybe not looking after their mental well-being, such as maybe engaging with their GP, looking after their physical health. That could also be another sign, poor physical health. And there is a lot of research going into now where poor physical health also can impact on people's mental well-being. Not eating too much, that's also another trigger or another early warning sign if someone's not eating as much. That could be maybe early warning signs of an eating disorder developing maybe, or it could also be that they are really very depressed and need some support. There could be other ones that I would probably say that are more in terms of risky behavior, maybe in terms of somebody acting out of their character, so maybe them putting themselves in riskful situations perhaps, and maybe frequent outbursts, whether it is of emotions or anger. Those could be some of the typical signs that we may see if somebody is actually going into a crisis of distress.
Thanks, Danny. That's really helpful. And Kurt, is there anything you'd like to add to that? Anything in particular that you think we should look for?
Yeah, I think you might notice subtle changes in people's behavior. And I think it is very important that you try to pick up these subtle changes. It might be, as my colleague Danny highlighted, a change in how they generally approach situations. It might be that they're isolating a bit more than normal. I think Daniela highlighted changes in the sleep pattern, for example, might be something affecting their eating habits. I think it's important that we notice these little subtle changes, and especially when the changes are happening over a period of time. And I think that for me is when it might be that we need to explore whether or not that individual is facing a lot of difficult circumstances in their life.
So what should you do, Kurt, if you think someone might be having problems with your mental health? If it's my friend or my neighbour, maybe a family member, what should I do?
There's a lot of things you can do. I think firstly is finding someone who you feel comfortable with, that you could talk these issues with, and it might be a friend, it might be a neighbor, might be a confidant. Within the Black Afro-Caribbean population, people tend to go to church. They might have a relationship with their local vicar. I think these are the spaces I will say, somebody that you feel comfortable with, that you feel that you could discuss these issues. I will say you need to take it there, because sometimes I know that these persistent worries do get on top of you, and it gets to a point where you find that you want to critically access services and that critical period. But we want to make sure that you're able to do something, and we support you with something before it gets to those stages.
Got you. Yeah, I can see it's really important to reach out for help before things get to that stage, isn't it? And I think that's what we'd really like to try to help people to do. So it's difficult though, isn't it, talking about mental health, and not everyone feels comfortable necessarily talking about it. So, I mean, in terms of the language we use when we talk to someone, I mean, Kurt, can you give us some help on what kind of words should we use or shouldn't we use when we talk about mental health?
I think one of the first things I will suggest is that we try to keep the discussion simple, and we look at a language that people are able to relate to and understand. And because I think language is a big issue in terms of how we talk to each other across different cultures. So I will say, try and keep it simple. Try and think about it not being too prescriptive. I think a lot of us are aware of some basic counseling type techniques. So I will say it's about making yourself more at ease to listen and trying not to jump in. I think it's more about trying to use those basic skills of paraphrasing, summarizing, and using those key things that we know about in terms of using the basic counseling techniques. But very much non-judgmental, very much non-judgmental and non-prescriptive.
Did you think it might help to just start by asking someone, you know, how are you? How are you these days? You know, how are you really? Something like that, and having the chance to talk maybe privately, or to give someone the space so it's not just a passing comment but a meaningful question. Would that be a good way to start?
I think yes. I think we need to check out with each other from time to time. And again, that's a good start. How are you? But when you ask the question, it's about being genuine about the question that you ask. You know, so I know sometimes we have this sort of way in which we greet each other and it's like a norm and civil attention. I think it's about being genuine. You see someone who doesn't look right, you want to, and you're really concerned about their mental health well-being. If you ask the question, how are you? You know, slow them down a bit and say, how are you today? Yeah, and be available to continue this conversation, not in passing. Yeah. Be available to continue this conversation.
Sure, and yeah, you're right. Just saying it differently makes a difference to the question, doesn't it? And to kind of give space for the answer. Danny, can you tell us then, is there anything that you should avoid saying or doing when you have these conversations?
I think, again, going back to the type of language, it is so important. And sometimes we say things quite freely without actually realizing the impact it may have. So in terms of maybe using the word section, that can really trigger, that can send triggers off in people, especially if they've got past experiences that have been quite negative as well. So the word sectioning is kind of a word I would try to avoid using. It just evokes quite a lot of fear in people. And I also think instead of kind of saying what's wrong with you, it should be more about what's happened to you instead. So yeah.
Right. Yeah, it's I suppose it's about what Kurt was saying about being non-judgmental, isn't it? So rather than judging that there's something wrong, to just ask someone factually what's happening in their life. That's the difference, isn't it? That you're talking about. That's really helpful. Thank you. And Kurt, I mean, kind of going back to this embarrassment, that some people might feel about asking someone about their mental health. What can you do to get past that embarrassment if you know somebody who you think might be struggling? How can you get over the embarrassment you might feel?
I think we need to ensure that mental health, we all suffer from mental health and well-being. There's a spectrum. So we all have times in our life when things are a bit more difficult. So it's making it an everyday life experience for all of us, because we all go through bits of mental health disequilibrium or well-being at some point in time in our life. So I think for me, it's about normalizing these conversations, so people don't feel less embarrassed about it. So yes, I think the idea is that, again, to normalize it in terms of making it part of everyday conversation, knowing that we all struggle with our mental health problems at times in our lives. It might be as simple things like when we have an exam coming up, we get a bit stressed out, and we find that very difficult on one end of the spectrum. And it might be on the other end of the spectrum when things really get on top of us and we have a mental health problem. It might be a bit more difficult to manage, and it might be a bit more difficult to have these conversations. But we shouldn't be feeling embarrassed about it. We should make these conversations as everyday as how we have an everyday conversation.
And thinking about those who might be struggling with their mental health, we know, don't we, that some people might be frightened of getting help and they might leave it until it is quite late. So rather than asking for help at the first signs of difficulty, people might leave it until they're quite unwell. Why might that be, Danny? Why are some people frightened, do you think, of accessing help?
One of them would definitely probably be the fear factor. And we all know that historically, people from Black and Asian ethnic backgrounds, were at a disadvantage and weren't treated equally. And we know that through other institutionalized, such as prisons as well. So I think there could always be that fear factor, and it could always be something that could be passed down through generations. Of somebody having a really bad experience, and that could put the fear into other people around them if they ever found they were becoming unwell. I actually, funny enough, I brought somebody who's very close to me to the hospital 2 weeks ago because they had presented to me saying they were really concerned about seeing things that they knew wasn't there. And I supported that person to get a CMHT assessment. And the first thing that this person said to me, they said, "Am I going to get locked up?" So there, straight away, there's already a fear from the beginning person. And I'm wondering how many other people probably feel like that, and they won't go for a mental health assessment because they're so worried that they might get locked up and have such a bad negative experience. And this probably has come from historically, as we know that, Black people were treated and mistreated very badly. So that possibly could be one of the main things I would say is the fear factor and the unknowing. So yeah, I'm not sure if Kurt wants to add on that one.
Yeah, Kurt, is there anything you can add to that? Why are people frightened of coming forward to get help when they have what might be an illness or a condition, which is nobody's fault?
Yeah, I guess in my experience, a lot of people might have preconceived ideas, or they might, for example, might have a neighbor who's probably been through the mental health system, and feel that they probably at the other end in terms of outcomes came out a bit worse. It might be that they were under previous treatment within mental health services and that the outcome again wasn't favorable. So they're a bit more cautious and reserved about accessing services. It might be that when we go into these spaces for some level of assessment, we don't see people who looks like us, talks like us, who gets what we are saying. So again, it might present as a sort of barrier to accessing services. So I think these are a lot of factors. But as we know, past history is a good determinant. So if you have a bad experience in services, you're a bit more cautious. But certainly sometimes when we go into those spaces, we want to feel a bit more relaxed, comfortable, seeing people who speaks our language, tend to get and gel towards us. Hence the reason why we make these discussions a bit easier.
And I think stigma as well is another one. I think people not wanting a diagnosis, and that diagnosis will then lead to having, you know, some form of stigma. So I think that's obviously one of the big things as well, not really maybe wanting it to be diagnosed with a mental illness. And then once you are, you know, you'll be stigmatized. So I think stigma also is still out there very much, and we do need to obviously focus on combating that within mental health services.
I totally agree. There's a lot of work that we can be doing to help destigmatize the illness. So I totally agree with what you're saying, Daniela, is about what are we doing to destigmatize these illnesses? What are we doing in terms of taking some of these interventions out of those spaces where people tend to look at us as mental health institutions?
Yes. So
what are we doing to really work towards this destigmatization within health, making it, as we say, a normal language, a normal discussion? So we need to think about all those different aspects and changing the way in which we perceive mental health illness.
Absolutely.
So if the person you're worried about maybe doesn't want to talk to you, you've made this approach, you've asked them, how are you? And you've made time and given space, but you feel that they're not engaging in that conversation. What else can you do, Kurt, to help that person rather than giving up?
I would say, first thing I would say, don't panic. I think sometimes when you meet someone for the first time, it's not an easy process for them to open up to you, but remind them that there are people within their own system or their own contacts that they find it might be easier to talk to. So it might be a family member, might be a friend, might be a confidant. Like I said, a lot of people in my cultural perspective tend to go to the church. So it might be that there's someone in the congregation, might be the vicar, the pastor. So I will say, have those conversations. I mean, there's a lot of work done in terms of, for example, going to your barbers. You know, a lot of us visit our barber or the hairdresser probably once every 6 weeks, 4 weeks. And people find those conversations are a safe place to have those conversations. But I will say, one of the things I'm hearing myself listening to my grandparents saying, a problem shared is a problem half. So the whole idea is that find someone to talk to. From my perspective, I will say I wouldn't panic. I will say to them, I would like to continue this conversation on another time. And I will tell them a date and a time when I'm coming to have that conversation again. And I will stick to it. I think sometimes we are not as good as clinicians to be holding on to those arrangements. You know, if you say that you're going to come back, and I myself, I come back in a week time or 3 days time, please keep those appointments, see them at the time and date. And it might be that part of that helps break down the process of their engaging with me to tell their stories or to tell me what's happening within their mental health.
I see. And that might maybe help people to prepare to have a chat about it if they were maybe taken by surprise the first time. It might give someone a bit of thinking time to consider that conversation. And
or be creative. Involve them in an activity. Be creative. I would say, you know, let's go for a walk. I mean, this is one of the easier things. So it might be that, I guess if I get to know them and I know what their interests lie, where their interests lie, I might suggest let's go to the cinema or go to ice skating rinks. And again, it's all about trying to engage that individual at their level. So if I get to know what their tender interests lie, I might suggest these little gestures, doing something more physical rather than sitting down and having a talk about it. It might be that as you do the activity together, people tend to open up to you because they feel a bit more relaxed.
Sure. Going for a walk or even ride bikes together maybe distracts from what could be quite an intense conversation. Could be a bit of a challenge to some people who might feel a bit shy about talking about how they're feeling. And then, of course, there's the 24/7 mental health crisis line, which is there to help people who are facing a mental health crisis. Kurt, if I was to phone that number, and I know that anyone can phone that number regardless of their age, who they are, if you're in one of the 5 boroughs of Southwest London, Merton, Wandsworth, Kingston, Richmond or Sutton, you can call 0800 028 8000. What would I expect, Kurt, if I phoned that number? Who would I get through to?
Well, first and foremost, the number is 24 hours a day, 7 days a week, 365 days of the year. So it's staffed by trained professionals who are well equipped and trained to listen to some of your concerns. From the idea of listening, they will be able to identify what might be the best service that you need at this point in time. And they will signpost you to the relevant service based on the conversation that you have with them and based on their needs, their concerns, and the level of, I hate to use the word risk, but the level of concerns they have about you in terms of your well-being and your safety. So they will be able to signpost you to the appropriate agencies, but they are there, they are trained professionals, 24 hours a day, 7 days a week, 365 days a year. Please use them.
Thank you. That's really helpful. And in terms of what to expect, if I was to phone the number and I'm speaking to a trained professional, would they what might they do to help me? You know, what kind of help might I receive if I phone that number?
Well, they will be very sympathetic and empathetic to your needs. They will want to listen so they get a better idea of what you're going through. Because I think it's important that they make that level of assessment with you to see exactly that they're signposting you to the correct agencies and the correct services. If for example, it requires a face-to-face meeting with a trained professional, the reassurance is that you can take with you a person who you feel comfortable with. So it might be a friend, it might be a colleague, you know, anyone who you feel comfortable with. You can feel free to bring them along to these meetings. Because again, it's all about looking at your mental health and well-being and what's the best outcome that we can identify for you based on your concerns.
Sure. And in terms of passing that number on to people who you think might need it, is that something you think, Danny, maybe if I was having a conversation with someone I was concerned with, you know, do you think that that's something that I could mention to somebody as a way to offer help from trained professionals?
Oh yes, definitely. I think it's such a brilliant idea. I didn't have that support when I was quite poorly or becoming poorly. So I definitely would be promoting that and encouraging that, you know, to anybody, you know, that's coming forth to you or you're concerned about, have that conversation, that open conversation with them and let them know about the crisis line. But yes, definitely. And I'll be promoting it as well in my own line of work and personal life as well. It's very much needed.
Thank you. Yeah, I mean, I think no one would expect somebody who's not a trained professional to act like a trained professional. I know that I'm not, but I think that if we can reach out and offer a conversation with somebody who we think might be struggling, and then give them a number that they can phone 24 hours a day, 7 days a week, and speak to professionals and get the help that they need, I'm hoping that that might help some people in our local area if they're struggling. So is there anything that either of you two would like to add? I think it's been really helpful conversation, and I'm hoping that we help people to reach out and help each other. So any last words, Kurt or Danny?
I will say for me, let's work together to make mental health issues an everyday conversation and everyday part of the conversation we have with colleagues, friends, loved ones, neighbors. So I will say, let's work together to make sure these conversations are normal, everyday conversations.
I would say sharing is caring. Definitely sharing is caring, and things are always better out than in. So definitely, that's my motto.
Oh, thank you so much. Thank you so much, both of you, for taking the time to take part. I really hope that we're able to help. If we can only help one person with this, it's been worth doing, hasn't it? I really appreciate your time and your expertise in your areas. So thank you so much, Kurt. Thanks so much, Danny. And thanks very much for listening.
Thank you,
Thank you.
Saffron.
Bye.
Bye.